if you think about the joint in your body that you use the most, more than any other joint, it's your thumb joint. So billions of cycles in all of our lifetimes we've pinched and twisted and grabbed. And all of the movement of the thumb, which is what makes our hand uniquely human, is dependent on one joint down in here, which is like the hip of the thumb. It's called the thumb base joint, basal joint, or thumb CMC joint. And that joint basically has high rates of arthritis and wear and tear, even more than what we know is in terms of rates of arthritis in the hip, the knee, or the back. What makes the hand and that thumb joint unique, though, is that because we're not walking on our joint and the hand is non-weight bearing, people tolerate high amounts of arthritis in that joint before they notice it. So there are people that may not notice pain, but notice with age just having more difficulties opening a jar. And a lot of that is arthritis in that joint, less strength, not able to open a jar like the way someone could when they're 18 versus 60. But sometimes the joint doesn't necessarily hurt, and people don't always see a doctor, don't need to, because they're able to tolerate and live with it and just know my hand isn't as strong opening a jar like when I was 18. And so the thumb has these degrees of wear and tear and arthritis in that joint and in other joints. But what's pretty amazing about the hand is people tolerate it and adapt to it. And a lot of that is based on the fact that the hand isn't weight bearing, so they're not walking on the hand. But if someone who's 60 had a little bit of mild arthritis in the thumb joint that they feel is mild, but an x-ray showed it to be severe, a lot of times if that joint were as arthritic as it is and in their knee, they would be crippled and not be able to walk. And so more degrees of arthritis can be tolerated in the hand because it's a non-weight bearing joint. But that joint can be treated very well, just like the way hip and knee doctors treat hip and knee arthritis. And so there's hip replacements for hip arthritis. In the thumb, there's a joint replacement for that joint when people have bad arthritis. And then there's treatments that are for more mild cases, like injections of steroids and different splints and braces and therapy. So there's lots of different treatments for the wear and tear conditions. And then there's more involved surgeries like a thumb joint replacement, which is a really cool surgery. One thing unique about the hand is that the thumb, basically that unique joint, the thumb CMC joint, has so much torsional torques and loads to it that no regularly engineered metals or plastics can be engineered for a joint replacement to exist, like in the hip or knee. And so the joint replacement for this thumb is a little old-fashioned sounding, but it's a really kind of more old-fashioned joint replacement where we simply remove the bone and use our own tendon that we coil up. We can take spare part tendons from the forearm, so one can be taken and coiled up in the place of the bone, and that natural joint replacement can heal very amazingly well with a cast for a month and then therapy for 2 months, that people have a high level of functioning. The thumb in someone who's very arthritic, who has that surgery, functions not exactly like their 18-year-old thumb, but closer to that than anything they've had for years, and people are really happy with it. And I would have that surgery in my own thumb if I needed it, if I had bad arthritis.